The key reason for the lockdown and stay-at-home order was to keep hospitalizations down, particularly ICU beds down, and to protect the most vulnerable residents in long-term care. So take a look at this chart. The dark blue color shows hospitalizations on a steep decline, and look at long-term care resident cases. After hitting a second wave high of more than 1,600, cases are down to 394 today, a number we haven't seen in almost 4 months. So it is encouraging news. This is the day the government targeted to have every long-term care resident in the province vaccinated with their first dose. A spokesperson for long-term care tells me as of yesterday, they were 95% there and are on track to meet that goal. I spoke with Dr. Nathan Stahl today. He's a geriatrician at Mount Sinai, and we talked about what this means for our most vulnerable residents.
This is amazing. The plummeting of cases that we have seen is just remarkable. Is this decline in community transmission, or is this vaccination? We can't entirely tease that out, but there are early signs that it's more than just the decline in community transmission.
Dr. Stahl says it's too early to tell how effective vaccines will be among long-term care residents and if they will reduce transmission. He believes restrictions should not be loosened up in the homes for a few more weeks. But there is no doubt there is euphoria. This is 88-year-old resident Devora Greenspan when she told us her reaction to her first dose.
Hooray!
Dr. Stahl has seen many others celebrate as well as they got their shots, including his 91-year-old grandmother.
What should be next for our elderly population who are still living at home in their apartments?
I think that age should be the greatest determining factor for prioritization of COVID vaccine rollout. I'm hopeful we might include some of the very elderly population within this phase 1 vaccine rollout, but we need supply to come in.
96% of COVID deaths in Ontario have been in people over 60. Dr. Stahl would like to see the most elderly residents who live at home who are 80 years and up vaccinated first and then work down in 5-year increments. And the Ford government's new finance minister delivered a financial update today. No surprise, the debt remains at a record high of $38.5 billion. And here are some more numbers. The government expects to spend another $2.6 billion on the pandemic to support small business and hospitals. That brings the total COVID spending to $13.3 billion. Now, this is all money provided by the federal government and allocated by the province, so it hasn't necessarily all been spent yet. The opposition has accused the province of sitting on the federal funds, which the finance minister strongly denied today.
I'm here again to tell you today that that money has been allocated, it's being spent.
Now, one other point, the Ford government is spending $427 million less on social assistance than budgeted during a pandemic, no less. When asked why, the response was that federal funds covered it instead. People with disabilities on social assistance, or ODSP, have been asking for more to live on to cover added costs for PPE, transportation and food. Currently, a single person with disabilities in Ontario can receive a maximum of $1,169 to cover all their expenses, including rent and food.